I'm going to be talking about I'm going to deliver two talks. One of them will be on the patient experience in the HOPE trial, which was um, the trial which led to insight clinical applicability of voxelotor in sickle cell patients. So this data has been presented many times before, both at ASCAD as well as at other conferences, so published data. So I'm going to recap what the whole trial data on voxelotor has shown. And within this session, we're going to we're going to put a lot of emphasis on the patient experience with voxelotor. So we'll be a couple of patients talking about this. And then the other trial will be based on the um, early management scheme, early access to medicine scheme, rather, data, which is relating to the use of voxelotor in the UK through this early access to medicine scheme. So again, this is data that has been presented before. There's not going to be anything particularly new on this, but it's a very important talk because it just supports the fact that this drug will hopefully have a role to play in the management of patients with sickle cell disease who fulfill certain criteria and cannot be treated with other ways. You'll hear everything about it on Friday, but overall the experience has been positive through patient access from the patient access through this early access management scheme. So by and large, patients that had been on voxelotor through the scheme have tolerated it very well, and the results that we saw in terms of increment of the hemoglobin and reduction of the hemolysis have been in keeping with what the whole trial has shown and what we have expected to see. In terms of adverse events, we haven't seen again anything beyond what we expected to see based on the whole trial safety data. The feedback from the patients by and large is positive, with a few exceptions whereby the drug has not caused any particularly significant positive impact, or a few patients have had some intolerance issues, as you would expect with any treatment one can be on. But overall, positive results, positive observations when it comes to patient overall well-being feedback, as well as increase of the hemoglobin and reduction of the hemolysis. But I think we need more experience and more data to show us correlation of what we see to painful crisis and other interference with reducing risk of end organ damage complications. So, the more experience we collect, the more data we collect nationally, but also internationally, the more prepared we will be as clinicians to identify suitable patients for this drug.